Hello, everyone. Thank you for joining on a Sunday morning. My name's Rishi. I'm a medical student at Imperial. I'll be giving roughly an hour talk on medicine and medical school. Just a word of warning, this is going to be quite a content-heavy session, so it is being recorded if you want to look back. If you have any questions, put them in the chat and I'll answer them at the end of the presentation. Okay. So myself, I'm in my fourth year at Imperial, which means I'm currently intercalating, which is when you'd spend a year doing sort of like a different degree. I'm doing a degree in management at the business school, and I'll be going back to medicine in my fifth year. I started in Marlow in Sir William Borlace's grammar school. And the slide on the right is just to show you that as a medical student, you can be involved in a lot of different things, not just your degree. So I work with a charity, I run a few societies, and I'm doing some research internships as well. Okay. This is roughly what we're going to be covering. If you want to take a screenshot, it might help you to keep track of the session. The first part of the session will be about medicine itself rather than medical school. So, sort of like the career. I think this is really important because for me personally, I didn't have many connections in medicine before applying. So, I didn't really know what the job was like. So, hopefully, that will help you with that. And then medical school itself. So, what sort of medical school to choose, and then all of the things about the application and the entry requirements. Okay, so medicine. So what do you do? I mean, it's sort of, we might think it's obvious what a doctor is. You diagnose and you treat your patients, but doctors do a lot more than this. If you've ever shadowed a doctor, or you know a doctor personally, you'll know that their weeks are very busy with lots of different things. So aside from being a clinician, you're also a teacher. You train those younger than you. It's a very sort of like familial system in the NHS, where the level above you is always teaching you and how to progress in your career. You'll also do a lot of research. You'll perform clinical trials or you'll run them yourself to better understand disease and disease treatments. You can be involved in structural change in health systems through management meetings. And you're also a public health professional outside of your typical working hours, which means you always have to promote safe healthcare, you combat medical misinformation, and you address healthcare inequalities. Okay. So, why studying medicine? So, being a medical student has lots of advantages. I would say these are sort of the qualities that you should have. And if you do have, you'll enjoy being a medical student. So, the desire to help people. You will see people that are very unwell, very sick, and you are there as their essentially only source of hope to push through their illnesses. It's a very rewarding career in that sense. It's very intellectually stimulating, so it's lifelong learning. Now that can be a good or bad thing depending on your personality, but it's a very innovative field, so you're always being challenged with new things to learn. It's a very trusted profession in society that comes with its own responsibilities. So if having respect and doing a respectable job is important to you, this is sort of like an ideal career. It's very hands-on, especially if you choose something like surgery. It's very, very practical. There's a lot of opportunity for leadership as well. I know it's a little early to talk about negatives, but I think it's important just to get this out of the way so we can look a little bit deeper into medicine. Um, think about your priorities in what you want from your life. If you are somebody that purely cares about money and wealth, then there might be careers which have a better effort to money ratio. Medicine in itself is a very well-paying career. It's a very stable career. Um, but there are easier careers to go into if money is your only preference. So if money is really important to you, then medicine might not be the path forward. But if you want a stable career and you have a lot of other benefits that medicine provides, then that's an advantage. There is an emotional burden. You are often in very high stress environments. You're in very difficult scenarios. So you'll need to have a good support network around you. Um, like I said, lifelong studying can be a good thing or a bad thing. It depends how long you want to do exams for, but you will be doing exams at every stage of your career. And competition as well. It's a system that rewards meritocracy. So it's a system that rewards the people that are the best in their field. So you constantly have to have that drive to compete. If you're somebody that likes to take a little bit of a backseat when it comes to work and just sort of get by, then medicine is maybe quite a difficult environment to survive in. If you're naturally a competitive person, I think it's a really good place to be. Okay, this is something I really needed when I was in school applying, sort of like an idea of how long it's going to take. Because everyone talks about being a consultant or being sort of like a GP partner, but it takes a long time to get to those positions. So if you're in secondary school, you'll go to medical school, it's about 5 to 6 years, depending on your university. After you graduate from medical school, you'll do foundation training. This is 2 years. However, a lot of people take a third year where they sort of take it as a year off, essentially. So you can expect around 2 to 3 years in here. This is when you actually get your medical license to practice. So after your first year of foundation training, you are now technically a qualified doctor. You will be paid from this point onwards. But then after your foundation training, this is very general training. I'll talk a little bit about each of these stages in more detail. But after your general training, you will then choose a specialty to train in. And this is about 7 to 10 years. Before then, you can sort of look to being a consultant or a qualified GP. Once you become a consultant, you have a lot of requirements within your hospital, within your local area. Some people will be a consultant until they retire. Some people will choose to go down a bit more of an academic route and become a professor. And other people might even use that strong medical knowledge that they've built to consider alternative careers. Okay. One bit of advice I got when I was in secondary school is don't just chase the next hurdle, the next title. Because you can see to be a consultant, you'll probably be in your 30s by the time this happens, and you don't want to miss out on so much of life just because you're chasing the next goal, the next goal. So the advice I got was to always live in the present, think about what you're doing today, rather than always thinking about the next stage, the next stage. But hopefully that'll be a bit more obvious as we talk through it. Okay, so let's talk about an F1 and F2. So this is as soon as you graduate medicine, you will be allocated to a deanery. So, for example, London is one deanery. There's obviously districts within London, so you could be assigned to Northwest London, for example. You could be assigned to a part of Scotland. You could be assigned to a part of Yorkshire, for example. It's a random allocation system, which is a recent change. So, as soon as you finish medical school, you'll rank your preferences, and then you'll be sent to a part of the UK to practice for 2 years. Um, an F1 and an F2, obviously, because you've just graduated medical school, you are expected to know your stuff, but it's your responsibility is less compared to the other doctors. One thing that you will always be involved in is ward rounds. So ward rounds, if you've been in a hospital before, you'll know that there might be a cardiology area, there might be a gastroenterology area, there might be a respiratory area. In these, there'll be wards, and the wards are sort of like rooms with like 4 or 5 beds in the room, and there'll be loads of them throughout the hospital. Usually at 9 o'clock in the morning, there will be something called a ward round. This is with the whole medical team, so there'll be maybe one or two F1 or F2s. Um, there will be some specialty trainees. There'll be some consultants, maybe one per group essentially, and you're going to every single bed and you're speaking to each patient there to essentially evaluate how their care is going. Because obviously, when a patient comes to hospital, they're not necessarily going to be ready to go home the same day. So you need to make sure that they're responding to treatment and whether you need to make any changes. As an F1, F2, you're typically just doing note taking. You're not necessarily responsible for the care. It's a 2 year foundation training, and the 2 years is split up into 6 4 month rotations. And these are random, and you'll be assigned different specialties. Okay, so that's the morning ward round. In the afternoon, you have jobs, which is what they refer to. Um, and this is typically the rest of the day for an F1 and F2. When you're on the ward round, the consultant will be making notes or telling you to make notes about what the patient needs next, whether that's a new drug, whether that's certain blood tests, whether that's they need an appointment from a different department. So these are the typical jobs for an F1 and F2. You need to call up different wards across the hospital to coordinate care. You'll need to carry out some tests yourself, practical tests. And ultimately, it's a lot of paperwork. Um, this might be more apparent once you've sort of done work experience, but yeah, there's a lot of paperwork regarding the legalities of care, discharge summaries, etc. So that's the typical day in the life. If you have night shifts, then these are the sort of things you can expect, whether that's continuing a care plan. So if somebody's been told to have a saline bag every hour or so, you need to be responsible to make sure that happens. If there's any bleeps or emergencies, so when there's an emergency, you will have a little like device that will go off and you'll need to go to that area. And you'll need to essentially make sure that all of the patients are safe until 8:30 in the morning, where the morning team will come and you need to hand over all of the notes. Okay. So after F1, F2, you have to choose between three pathways. I mentioned that you can take an F3 out, and people do an F3 either to prepare for applications to specialty training, or they might just go on holiday, or they want to do some locum private work just to make a bit more money. Um, yeah, so lots of people take a third year of foundation training. But once you've finished that, you will do specialty training. So you have three ways to apply. You can either apply to be a GP, you can either apply to do medical training, or you can apply to do surgical training. So say you do a GP, it's 5 years of training typically. And at the end of the 5 years, you have an exam to take. It's quite a difficult exam. But once you've done that exam, you will now be a fully qualified GP. Before this stage, you'll be known as a GP trainee. It's primary care, which means that it's as soon as a patient has a problem, they'll book an appointment. I'm sure you all have been to your GP multiple times, so you'll know what these appointments look like. The sort of advantage of a GP is that you're completely independent. Obviously, you have a couple other people in the building to help you, but you're largely independent, and you have a very close patient and doctor relationship, especially GPs that have been in one area for 20, 30 years. They'll know all of their patients, all of the patients' families, everything that happens in the local area. So they'll become a real expert at the local level of health. Obviously, not everything can be treated at a GP level. So that's where you might be referred to a hospital for either medicine or surgery. If you choose medicine, you're looking at 7 to 10 years of training before you become a consultant. There are two options. I know this is a lot of information, but I think it's really handy to know this before applying. You can either choose to do internal medical training, known as IMT, or you can have a run-through program. What this means is internal medical training means you do 2 or 3 years of, I think it's 3 years of just general medicine. Essentially, you're doing F1 and F2 again, but you're doing more advanced things and you're being given more responsibility. After that, you can apply for things like cardiology, neurology, etc. Or you can do a run-through program. This could, for example, include ophthalmology or obstetrics and gynecology, which means instead of doing IMT, you go straight into those clinical pathways. And again, it's looking around 7 to 10 years. There's no advantage. For example, if you want to do cardiology medicine, you have to do IMT before cardiology, etc. Medicine itself, I know this whole talk is titled medicine, but medicine within the field means something slightly different. All of these three things are a different career. It's a very hospital-based thing. You're looking at the diagnosis and delivering medical treatment, and you're also ensuring that you're caring for the patient until they're ready to go home. So as soon as the patient walks in the door and the patient leaves, you're responsible. If they need a surgery, that's when you refer them to the surgical team. So surgical training, again, you're looking at roughly the same amount of time. Similar concept to the IMT, you have something called core surgical training, which is again 3 years, although you can do it in 2 years in some cases, of essentially just rotate around different specialties. So you need to do core surgical training if you want to do breast surgery, if you want to do colorectal, so anything to do with the colon or like anything to do with the stomach, really, you need to do core surgical training. And some specialties are run through, which again means that you don't need to do this core surgical training, like cardiothoracic and neurosurgery. Straight after F1 and F2, you apply for this. This is theatre based, so it's still in the hospital, but it's very, very specialized practice. And although you will see patients, it's less contact than usual, less patient contact. So there's its advantages and disadvantages. You need to apply for these things. So essentially, you need to have not necessarily a CV, but you need to have a portfolio. And different specialties have different competition ratios. There's a link here, but if you just search NHS competition ratios 2024, you'll see the different competitions. So it really depends on the specialty, which is more competitive. IMT is and CST are sort of like a 3-to-1 or a 4-to-1. 3 applicants to one space, that is. Whereas for cardiothoracic surgery, you're looking at around 40 applicants to one space. So these are a lot harder careers to get into, which is why you need to work hard in medical school doing lots of extracurriculars. I'll talk a little bit about how to succeed in medical school later. But yeah, this is just something to keep in mind. And obviously, these specialties all pay slightly differently. Depends which area of the UK you are, and which department, of course. Hopefully that makes sense. If you are a trainee, a specialty trainee, you will still be part of those ward rounds. Either you are rotating between specialties if you do that IMT or core surgical training, or you will have a dedicated ward or hospital. So I mentioned ophthalmology is run through, you'll be based at an eye hospital where you do your ward rounds. You'll have a little bit more responsibility. Say, for example, the consultant is busy, you'll be leading the ward rounds, which means that you'll be the one to look at all of the patient reports and tests and decide whether to change their treatment or not. Um, in terms of sort of like you will now run clinics if any of you have ever been referred for treatment, for example, if you have say like diabetes, you might have your GP appointment, but you might meet an endocrinologist. Trainees are usually tend to run these clinics alongside consultants, so you'll be meeting with patients regularly and you'll be building that independence in your care. To trainees, I said that it's sort of like a 7 to 10 year program. Every year you increase your responsibilities and you increase what you can do. You'll be teaching foundation doctors. You'll have more responsibility in the wards as you go through. And if you are a surgeon, you'll start to lead surgeries by the time you are, say, like a surgical trainee level 7 or a level 8. Okay, and then finally, consultant. I think everyone talks about being a consultant, but it's a lot harder to be a consultant than I think people realize. It's not a guaranteed thing. This is because sort of if you have a cardiology department in a hospital, you only need 6 or 7 consultants maximum, depending on the size of the hospital. And there's obviously a lot more than 6 or 7 cardiology trainees in that hospital. Becoming a consultant, you'll typically need to do a fellowship for 1 year. This means that on top of your like surgical training for 7 to 10 years, this is where you take, say, an area of the medical specialty and you do a lot of research or you do a lot of clinical practice in that area. Nowadays, it's becoming more common that you need a PhD to become a consultant. You can balance that alongside your surgical training or your specialty training, but some people just take time off. I think because you saw how long the medical career pathway is, I think by the time I apply for consultancy, a PhD will be required. And it's also location and timing. So, like I said, if an area has a maximum of 5 consultants for this department, you either have to go to a different location to be a consultant or you have to wait for one of them to retire. So it's not necessarily the easiest thing being consultant. In fact, I think at the moment, take neurosurgery, for example, it's a very competitive thing to get into. I think there's actually too many consultants in the UK, which is why a lot of neurosurgeons are looking to move abroad so that they can get that top band of income. But as a consultant, you are now responsible for patient care. You are the leader of the medical team. You will be deciding what drugs to give. You'll be deciding what tests to do or what surgeries to go through. You will have to explain all of the treatment decisions to the patient. Obviously, patients have autonomy in their care, which means they can choose to an extent what they want to do, but you're responsible for communicating everything to patients. And if you're doing a surgery, you're the lead responsible for this. There's a lot more responsibility, but it obviously has its rewards as well. You will need to train every junior doctor level, foundation doctors, even medical students. If they're on placement, you will need to oversee them. You have appraisals every year. So to maintain your consulting license, you need to do a certain number of surgeries, a certain number of hours, a certain number of CPD, which is continuing professional development points, which could be attending conferences, etc. But as a consultant, you now have a lot more opportunities. You can teach, you can go into medical management, and you can even do business. Lots of healthcare businesses are very much in demand for consultants because they'll have often spent 10 to 15 years in their specialty. So they have a really rich knowledge, which is desired by lots of businesses. So lots of consultants do this as a part-time venture as well. Okay, so before I go into medical school, I think I'll talk a little bit about rewards and challenges, which I've seen through my time on placement. Um, I'd say one big reward is a very tangible and meaningful benefit. If you take a lot of other careers, for example, you're doing, say, a big project, you're doing a job, but you might not be able to see the benefit actually happen because it's really far down the line. Whereas with this, you can see a patient being unwell and feeling better. Or if it's a terminal illness, you can see them being more comfortable in the position they were in. So it's a very heartening experience being in medicine. There's job security. If you pass your exams, you will get a job, most likely. I know that there's applications and different competitions depending on specialty, but you will get a job. And if you keep maintaining your clinical standard every year, you will progress through your career. You have opportunities to go global, especially if you study medicine in the UK. It's a very desired training location. And it's a very influential environment as well. The people in medicine are very driven, very hardworking. They are people that will change the world to avoid being cliche, of course. So you will see yourself improve in that environment. There's lots of opportunities for leadership, and there is a diverse working life. You're not doing the same thing every day. You are doing a lot of different things. I'd say the challenge is work-life balance. I think this is something that a lot of medical students feel that if take me for example, I find neurosurgery very interesting, cardiothoracic surgery, so like heart and lung surgery, very interesting. But those are careers with really long hours, and I don't see myself personally doing that in my 40s. There are some people that do. Everyone has their own sort of point of equilibrium on the work-life balance scale, and I would say that you should really think about that. There are obviously medical specialties which have a very good work-life balance. Take a GP, for example. It's very typically 9 to 5. You can be part time, which means you can do 2, 3 days a week. That's probably the best work life balance there is. But there are other specialties which are harder. So you can choose between them in medicine. It's lifelong trainings and exams. It's competitive all the way through. You can see even becoming a consultant is competitive. So if that is something that's difficult for you, then I think that's an important consideration to take. I don't want to make this too negative, but I've just written a few others here. I think the other key thing which I think is important to highlight is burnout, stress, and mental health. Every doctor will be stressed. Every doctor at some point will have had burnout, and this is where your reasons for choosing medicine is really important to get you through this. If you are truly passionate about medicine or helping people, then you will be able to get through the stress and you will be able to get through the burnout. But if you chose medicine just because of the prestige or the fact that it supposedly pays nice, this will be really difficult to get through. If I give a little example, I was on an obstetrics placement, which essentially just saw like childbirth and maternal health. That ward round was some maybe very, very emotionally draining for me. I like to think of myself as a fairly like emotionally stable person. It was draining in the sense that one room you're really happy that the baby's born and the mother's healthy, and in the next room there's possibly the worst possible outcome, and then you've just got to keep switching between that throughout the whole hospital. um it can be very draining. So if you have really strong reasons for going into medicine, then that will help you through this. But it's definitely something to keep in mind. In fact, it's a very common interview question: how do you manage stress? Because you will be stressed at times. Okay. Okay, so we're going to medical school. Actually, maybe just let me have a look at the chat to see if there are questions. Okay, GCSE in sixth form. I'll talk about that in this section. Okay. Again, if you want to take a screenshot of that so you can keep track of the slides. How are we doing for time? Okay, so medical school, there's lots of different types. I'm going to give you sort of like the rundown of what they are and then give you my personal opinion on them. Um, there are essentially 3 stages to medical school. There's preclinical, which is, oh, sorry, the slides, the content of that is not correct. Okay. Um, so traditional, sorry, there's 3 stages to medical school. There's preclinical, which is 2 years. This is sort of like very lecture based. There's intercalation, which is optional. I'll talk a little bit about intercalation in a bit, and clinical, which is where you're very much on placement. Now, in a traditional university, preclinical, so in Oxford and Cambridge, the first 2 years are very, very lecture based. In fact, I don't think they have any placements, or if they do, it's very, very brief, which means you're sat in a lecture theatre essentially every single day doing lots and lots of lectures, lots and lots of content. If you move on to like an integrated curriculum, I think actually most medical schools in the UK are integrated. You will have lectures and introductory placements. So in my first year, I think it was 4 weeks of placement. And in my second year, I think I had 6 to 8 weeks of placement, um, aside lectures, of course. And then in problem-based learning, right from the beginning, you're doing the vast majority as placement. So it's all like a spectrum in what your preclinical years are like. Your intercalation, I'll talk a little bit about that on the following slide, but clinical, they largely follow the same spectrum. So this is where the difference between the universities is just sort of what hospitals they have access to. London hospitals are going to be very high tech, but they might not be representative for the whole country, and then vice versa. Clinical years, so like there's 3 years in clinical medicine. You do a general specialty, a general sort of like clinical placement with medicine, surgery, GP. You then have a year of very specialist placements, sort of like dermatology with the skin, pediatrics with children's health, emergency medicine, for example. And then in your final year, it's a bit more general when you study for exams. I'll be honest, it does not matter which one you go to. I would say if you're going to choose one based on what type of person you are, or what type of person you would succeed in. A traditional university means that you have to be very good in the classroom setting, because you will spend a lot of time on lectures and you potentially won't have that placement experience. And integrated is a nice balance between the two. And a problem-based learning university, essentially, it's a lot more self-driven. You're sort of put into small groups. You have to research conditions, and you have like a touch point with a supervisor. So it's a little bit more fluid. And there you can see there's two very good universities there that are problem-based learning. So it's not like this is a ranking system. This is just based on university styles. And I think that all universities to eventually are going to move to the integrated system just because it has a lot of evidence behind it. So what you should consider is type of university. I mentioned about your sort of style of studying. Unfortunately, like academic requirement does matter. You can't just choose a university. If you want to go to Oxford, for example, you need A star A, I believe. I'm not. You might need to double check that, but there'll be different A level requirements. The student environment is really important. This is something I've noticed in my degree in management in the business school because there's a lot of students from different universities. Imperial, for example, has this reputation of being sort of like very hardworking and very sort of like driven, um, compared to other universities. That can be a good thing or a bad thing depending on who you are. So that's something to keep in mind as well. And then obviously like normal university considerations, location, cost of living, etc. One of the biggest reasons I chose Imperial was because I was in London. I wanted to live in London for some time. I mean, I still commute to London, but I wanted my working life to be in London. You have a lot less responsibility as a student, which means you can enjoy the luxuries of London a bit more. But you also have to keep in mind cost of living, etc., etc. What you should not consider, and I think this is really important because these things really don't matter, and though you might just end up in the wrong environment, which is a worse consideration. University rankings. I say that as Imperial ranked second in the world last year, so first in Europe. But even still, I wouldn't say just choose Imperial because it came that high in the rankings. It does not matter at all. In fact, they don't rank universities based on the quality of their medical degree. They rank it based on postgraduate research, which doesn't matter for us, medical student. Prestige and legacy. Sorry, that's a spelling mistake. Prestige and legacy again do not matter because you will be there for 6 years, 5 years, or 6 years. And prestige and legacy won't help you. This isn't like a career like I don't know, finance, for example, where there are target universities. There's no such thing as a target university in medicine. So you're better off going to an environment that's more suited towards you than just choosing the top ones. The top ones. Ease of exams and entrance. Just because a university has a lower entrance requirement doesn't necessarily mean to say that it's a worse university. You shouldn't judge it based on their sort of UCAT cutoffs or A level requirements. I'm an Imperial student. I've done well at Imperial. That doesn't mean to say I am better than every medical student in Bristol. I've met people in Bristol University that are a lot more accomplished than I am. Just because Bristol's easier to get into doesn't mean it's a worse university. And I would really like highlight that it's your choice as a student where you go to. You don't need to consider everybody's opinions. Just because your teachers say one thing or your family might say another thing, and that doesn't matter, because ultimately you're going to university and medical school is very difficult. Um, so you don't want to be in the wrong environment. You want to be in the most suited environment to you. Okay, exams in medical school. I wanted to sort of do sort of like a life in medical school, but I didn't really know what to include. So if you have questions on what I get up to, then you can put those in the chat. But um, medical schools, they differ the most when it comes to exams in the preclinical stage, and they become more standardized the further you progress through medical school. So in the beginning stages, in the first 2 years in the preclinical area, you're learning a lot of the foundations. So you're learning a lot about the organ systems like cardiology, the conditions in cardiology, and all throughout the body. You'll learn anatomy. You'll probably learn some biochemistry, and then there'll be some special modules. So we had a lifestyle medicine and preventative medicine module. We had case studies, etc., etc. So this is very dependent on the university. Um, Once you get into your clinical years, so this is sort of that 3 years of clinical that I mentioned, you will have practical exams called OSCEs. Um, yeah, I can give you a little bit of information about those if you want, but they're practical exams, and then you have written exams, general medicine. The reason why I say it's not completely standardized is because every university will write their own exam, but everyone essentially uses the same resources. So there's two question banks called PassMed and QuestMed, and everybody studies from those. No matter what university you're in. So it becomes more standardized. And in the post-clinical, which is your final year in sixth year, you will do two assessments that every medical student in the UK needs to do if they want to practice medicine in the UK. So one is a prescribing safety assessment. It's sort of like knowing what quantities of drugs to give for what conditions. And then the medical licensing assessment, which is essentially your final exam, your finals. Um, and these are completely standardized. Everybody will do the same exam. I think the final years just sort of did theirs maybe 3 or 4 weeks ago. Yeah, so these are the exams in medical school. It's a lot more exams than other degrees. You'll be studying more, but that's because there's more content to cover. Intercalation. So intercalation is a topic that's talked about a lot. If you don't know what it is, it's either in your third year or fourth year, depending on your university. And essentially you take a year out from medical school, and you're doing something else. So a lot of people do say cardiology for their intercalation or gastroenterology for their intercalation. And in that year, you will gain a lot of specialist knowledge in that one department, and you'll have the opportunity to practice research skills. There are alternative ones as well, but I'll come into that in a minute. First of all, it depends on what university you are at. Is it compulsory or not? If it's compulsory, you have no choice. You have to do it. If it's not compulsory, then I think the second question is really important, which is, does it matter? What I will say is doing an intercalation does not improve your chances of getting into a medical specialty. It's explicitly included in application requirements that there are no points for doing intercalation. It used to be a few years ago, but no longer. So if you don't see yourself wanting this sort of benefit, then taking a year out doesn't make sense for intercalation. If you do want to gain specialist knowledge in one subject, or you do want to go to research, or you do want to maybe consider going to a different university, then you might consider intercalation. Like I said, there are other intercalations. So I am at the business school. I think Imperial is the only one in the country that does a business option for intercalation, which is management. We have lots of modules. We have very business focused modules. We have medicine management modules. I've really enjoyed my time so far. It's probably the most intense intercalation option possible at Imperial. But I've met some really, really good people, lots of great professors. You can do other intercalations as well. So, for example, UCL has like a computational modeling one. You can do a master's in research, a master's in whatever, essentially. And you can even consider going international for intercalation. But again, this will depend on your university. So Imperial won't let you go international, but there are some that do. Intercalation it comes down to a personal preference. If you choose a university that doesn't require intercalation, your degree will be 5 years if you choose not to do it. If you choose a university where intercalation is compulsory, it will be university dependent. As in, you'll have to do it. It's just where you do it will depend. Okay, but like I said, it doesn't count for beyond medical school. So it's only a personal choice if you want to do it. So the application timeline, I would assume a lot of you are in year 12 when applications start happening. If not, even if you're younger, this is still useful to know. In year 12, you're working towards your predicted grades. Every school will do predicted grades differently. My year was a little different because also it was that first year of COVID. I was in year 12. So predicted grades were slightly different, but essentially you just want to make sure you're doing well in all of your exams. So you can get the predicted grades that you will apply to university with. You know how I said that, Imperial might have a requirement of A star AA, some will have three A's as requirements. They will use your predicted grades to see whether you're eligible or not. The next stage is doing the UCAT. You typically need to do the UCAT in the summer between year 12 and year 13. There's been a recent change, as of sort of like the last year or two, where there is no longer the BMAT, which was another entrance exam. It's now every university uses the UCAT. Again, you'd sort of do this before year 13 starts. Then in October of year 13, you will submit your personal statement. This is sort of like a written, not a CV, but sort of like a reflection on your experiences. There's again been some changes on personal statements. I'll talk about that as well. After you've got your personal statement, you might get offers for interviews, depending on which universities you're successful at. You have interviews done, and at that point, you can expect to get conditional offers, which sort of say if you get these grades at A level, you can come to this university. This is very much sort of like a hurdle race. Once you get past one stage, it will no longer count to whether you get the offer or not. So once you've got your predicted grades, it will not impact if you get an offer. Your personal statement will not impact if you get an offer. All of these stages are just to get to the next one. So once your personal statement has been deemed good enough, you'll get an interview. And then once you've got an interview, if you've gotten an offer, they're not going to have two candidates and say which one had better predicted grades, which one had a better UCAT score. That doesn't matter at all. It's very much a hurdle race. Okay, and I have a little bit of advice for all of these. But if we just talk a little bit about entry requirements, A levels are university dependent. There was a question about what A levels to choose. Depending on the university, typically chemistry is required. Biology is usually required for some universities as well. So Imperial, UCL, Oxford, Cambridge, they require biology. Your third A level can be whatever it is. You don't need to choose maths. There's no advantage of choosing difficult A levels beyond this. So I know people that do geography, did Spanish. It does not matter whatsoever. What matters is your grade. So it doesn't make sense to do four A levels for purely a medical point of view, because you'd rather have three and focus on getting really good grades than doing four just for the sake of it. In terms of UCAT, I mentioned all medical schools will use the UCAT, which is an entrance exam. The BMAT, which did exist, will no longer be relevant. Um, there are currently no guidelines on cutoff. There are sort of like rumors around different universities. Essentially, different universities will have different requirements. I would say to get into the top universities, you should aim for about 3,000. If you don't know much about the UK, I'll talk about it in a little bit, but it's worth doing your own research. And there was another question on GCSEs. Most universities do not care, and that's just me being bluntly honest. Nobody really looks into GCSEs. Some universities ask for a grade 6 in English and maths, but I would assume all of you are doing English and maths anyway. Oxford University might use it. I say might because they used it for my year. Um, I don't know whether they still use it or not because I'm not part of their admissions team. If you do really well in your GCSEs, and by really well I mean sort of like all nines and eights, then you can consider Oxford University. If you don't get all nines and eights, then I would consider, if you really want to apply to Oxford or Cambridge, I would consider applying for Cambridge, because GCSEs are very competitive when it comes to Oxford. And well, as in the people applying to Oxford are very competitive in their GCSEs, and different schools will have different amounts. I remember people in my year had 16 A stars, but my school didn't even offer 16 GCSEs. So GCSEs largely do not matter whatsoever. You just need to get enough to be able to do these subjects at A levels. Okay. And I would re-emphasize the point that it's better to choose A levels which are matched towards your skill set rather than just doing them because the top scorers in the class are doing them. It doesn't matter what the top scorers are doing because they're not applying for medicine. There are people in my position, like I said, that did a very, very easy third A level just because they wanted a good grade in it. Okay. Work experience, because this is a thing that is sort of talked about. It's not really a lot of clear guidance and doesn't necessarily play a part in the application system, just sort of like little bits here and there. There's a few different types of work experience. You can do in-person medical experience at sort of like general practices or hospitals. You tend to not you're not really allowed to do it at your own GP or you're at your own hospital because of sort of like confidentiality issues. But you can sort of apply to any other one really. You can do part-time work as a receptionist, healthcare assistant, etc. Use personal connections or LinkedIn. I personally didn't actually have many personal connections, but also my year was during COVID, so everything was cancelled anyway. LinkedIn is a really, really good system. Obviously, there's sort of like an age requirement to be on LinkedIn. I don't know what it is. I think it might be 16. But yeah, use that because I notice a lot of sixth form students connecting and reaching out to me asking for advice. Um, so yeah, consider it. There's other experience you don't have to have in personal medical experience. There are virtual medical experiences. Essentially, all you're doing is just trying to show that you are interested in medicine. So if you do like a research project, whether that's an EPQ, if your school offers that, or you can do your own little research project, read books, if you volunteer, you go to conferences, essentially anything that shows your interest or anything with these skills, leadership, communication, and teamwork. Like I said, they do not rank your work experience. It doesn't matter how much experience you have. What it matters is your reflection. They essentially just want to see, do you have the skills that are desired in medicine? And do you have an interest in medicine? Can we see that you have an interest in medicine? So record and reflect on literally anything. It can be DV, it can be Duke of Edinburgh, it can be literally anything. And make the most of work experience if you do get everything. I would use work experience to try and identify whether you really want to do this career. Because a lot of people say they want to do medicine, but then if you spend a whole day on work experience and the wards, and you feel sort of like that tiredness towards the end, then you really know the answer whether you want to do it or not, if you're still energized to come back the next day. Okay. When it comes to who to contact for work experience, I would recommend either GPs or consultants. If you reach out to medical students or trainee doctors, they often don't have the authority to allow you to come to work experience. For example, I can't just take people because I am there sort of on a contract myself. You should really look at the sort of like higher up and more senior doctors to do work experience. And there's no sort of deadline to do this. I would say as long as you've done something before your interviews and your personal statements, so something before year 13, even if that's actually 1 day or 2 days, that's more than enough. Okay, so personal statement. Personal statement in my year used to just be essentially just have 400 words to write whatever you want. It's changed now to try and make it a little bit more fair. So there's 3 questions. The questions are on screen here. I'm not sure my class on. Okay. So why do you want to study medicine? What experiences have you had that demonstrate your suitability for a medical career? And how do your personal qualities make you a good fit for the demands of medical practice? So if you sort of see those questions, it's kind of what I mentioned in the work experience slide. Why do you want to study medicine? What experiences have you had, and what are your skills that make you a good fit? So some do's and don'ts. Reflect on your experiences. Answer the question directly. What you shouldn't do is just list out everything you've done in a bullet point list. If they wanted a bullet point list, they'd ask for that. You'll actually be negatively marked if you do that. So answer the questions directly. They've mentioned here empathy, resilience, and strong communication skills. Give an example for each, and maybe any others that you feel are relevant. Don't repeat stuff between the three. Have a think about everything that you've done, even if that's, you've taught one session or you've mentored a student or even you've worked a part-time job. All of that will relate to this. They're not looking for the person that's had the most surgery experience or the person that's the best doctor already. They're not hiring a doctor. What they want to find students that are willing to learn and have the right qualities to be a good medical student. Ask people for their opinions. Send your personal statement to people that you think are trustworthy or experienced within the medical field, but you don't need to change your statement with every opinion. I think I sent my statement to 10 people, and I only acted on one or two people's changes because I didn't agree with some others. It's your own personal thing. It's your own personal statement. So ask for opinions, but don't necessarily change it with everything. And the harsh reality of it, personal statements are only considered by very few universities. It's not necessarily an essential stage. I know, for example, at Oxford and Cambridge, they have an interview where they have your personal statement printed out. But at other universities, for example, when I did my interview at Imperial, I'm fairly certain that they'd never seen my personal statement before. So it is also like a formality. It doesn't mean it's a waste of time because it will help you in your interviews, which I'll go on to the next slide. Oh no, sorry, I'm going to talk about A levels first. Okay. Choose A levels based on requirement and enjoyability. I've talked about that point before. Um, I think it's important to study smart and not hard. If you're a student in here or a parent of a student in here, you're not going to succeed just because you lock your door and you have a textbook open and you have a notepad and pen and you just sit there for 5 or 6 hours. That's not how you study. I would say I'm someone that's done quite well academically, and it comes from me that you can't study like that. You can kind of get away with it in school, but once it comes to university, you're going to have to rapidly change your studying strategies to keep up with the pace of the content. So what I would say is to use active learning. I have like a little bit of a sort of like a flowchart of how to study if you find that useful. Um, so the first thing to do is you're going to have classes and you're going to be taught content. The problem is that this is passive. You're just sort of sitting there listening to your teacher, and you're going to forget it. Um, I mean, I think we'll all have had the experience where we sit in a class, we listen there for an hour, and 2 days go by, 3 days go by, and we can't remember anything that we were taught. So use that class to familiarize yourself with the content. Try and figure out what are the key words, what are they roughly trying to teach me. But then you need to go home, ideally on that same day or the next day. You need to go and independently study that. Don't just read the textbook and read your own notes. Use YouTube where people explain it. Use study guides, draw diagrams, speak to people. Spend a small amount of time independently learning that. Okay. The next thing I say is look at exam questions straight away. What do you need to know? So take photosynthesis, for example. There's so many stages to photosynthesis. I've never had an A level question where they say, list me every single stage of photosynthesis and list me every single enzyme that's involved. That's not the question you're going to be asked. You're more likely going to be asked, describe the light independent reaction and the key molecules that are formed. So if you look at exam questions, you will know how to use the content rather than just memorizing textbooks, which won't help you at A levels. You'll know how to apply that content. Um, I want to take a little bit of a break from that flowchart and talk to you about the forgetting curve. I know this has gone slightly away from medicine, but I think it's important because medicine is a very academic career, and knowing how to study using science-based techniques is important. So this green line is how much we remember something, right? The first day that you get taught something in a class, you will remember 100% of it. In 1 day's time, if you don't do anything, you'll only remember 60%. And by 3 days, you'll remember nothing. This is on average with science. So you can see that if you learn something in class, 3 days later, you're not going to remember anything. So what you need to do is you need to do something called spaced repetition, which is after 1 day, you need to relearn it. And that way you can see for it to get to 60%, it's now taking 2 days. And then if you relearn it again, once it's gotten to 60%, it now takes 3 days to forget. So the rate of forgetting becomes slower the more often the more often you consolidate your content. And there's a very good application that I would recommend using. It's free to use. It's called Anki. Um, you might think of all of this and think that this is irrelevant. I can just sort of sit and study it. But what I will say is that it's better to do this earlier than later. I personally didn't do Anki in A levels, but if I could go back, I would because I use it now in medical school. If I give you an example, I have Anki open here. You can see I spent a lot of time last year. I spent 300 hours on Anki last year. but that's because it's a really helpful platform. So you can see here across my two decks of flashcards, there's about 2,200 cards here, and they're not easy cards to they're not easy things to learn, right? They're very, very varied, very varied, very number heavy, and there's so many cards to go through. Anki is a great platform because you essentially make your flashcards and it will follow the forgetting curve for you. It will automatically allocate cards 1 day, 2 days, 3 days from now based on when you last reviewed them. So I would recommend looking into it if you haven't already. So yeah, make your flashcards. If you don't do flashcards, I would highly recommend it and then actively maintain this knowledge. I wouldn't start doing practice questions until close to the exam time personally, although this is personal preference. But when you do pass practice questions, look at mark schemes because mark schemes tell you how to write answers. You want to be the most efficient. You want to answer questions as efficiently as possible. So essentially, if you just copy mark schemes, that's ideal. Revise with friends. Everyone finds A levels hard. Even though I did well, it doesn't mean to say I found it easy. I found it difficult as well. I just spent a lot of time studying. Revise with friends. Find friends that have similar goals to you and do the same. Plan what you're doing. Start early using a timeline, so you know which month by when do you want to actually properly start studying. And I think this is really important, which is work-life balance, because like I said, for medicine, you can literally study forever. You can study 24 hours a day for your whole life and you still won't know everything. Um, you have to be very honest with yourself with how much you can study. So you can't effectively study for more than a certain number of hours in a day. For me, it's 7 to 8. I can't, if it's beyond 8 hours, what I'm studying is not productive. It's sort of going in through one ear and out through the other. So you have to try and figure out where your sweet spot is. I would recommend doing something called the Pomodoro technique if you're going to have a long study session. The Pomodoro technique essentially means you study for 25 minutes, you break for 5. You study for 25, you break for 5. This is essentially sort of like, imagine if you're running. If you run for 25 minutes and stop for 5, run for 25, stop for 5, you're more likely to be able to do this for longer. If you just ran for 2 hours, you'll be really exhausted by the end of it. So that's why taking structured small breaks frequently is really helpful. These are not essential, but I would say the more you sort of do this, the easier your life will be. And it's about studying smart. I think for GCSEs, I was sort of studying 8 to 9 hours a day. I still did really well, but I did a lot better in A levels, and I studied about 4 hours a day, which is about half the time, but I studied a lot more effectively. So you will make your life a lot easier if you study smart. And there's lots of videos online about science-based techniques. Okay, the UCAT. The first step to do is familiarize yourself with the structure and techniques. You can do this as far in advance as you want. There are 5 sections. 4 sections are very question-based, and then the fifth one is also like a situational judgment. Look at videos, go to a course or something like that, or question bank, where you can familiarize yourself with the structure. The point about UCAT is that it's not something that you necessarily revise for. If you know the structure, you'll know that there isn't like a textbook to memorize. So the key thing is to practice and to keep practicing questions. It's a very skills-based exam. The difficulty in the UCAT is not the questions itself, but the time pressure. Um, the most time pressured section was abstract reasoning, which works out to sort of like 12 seconds a question, which sounds very difficult. It is definitely doable, but you need to practice with that time pressure right from the beginning. Every time you do a set of questions, you have to go back over them. There's no point just doing questions and never looking back over them and just keep doing them because you'll make the same mistakes over and over. Every sort of like hour session, sit down for about 15 to 20 minutes. What did you do wrong and what can you do better? And you'll notice your progress gets a lot better like that. In that point, track your progress, track how much you're doing, track your percentages. You don't want to become very data focused, but it's a good idea to see. I wish I had my question bank open, but you could see that as every time I was reviewing really diligently, my percentage was going up. And every time I stopped going over my questions and reviewing what I did wrong, my percentage would go down. Revise with friends as well, if you know friends that are doing the UCAT, because you are not in competition with your friends. I think there's about 10,000 spaces for medicine every year. That's a lot of spaces you and your friends can get in. You and your friends can also all go to Oxford or Cambridge if that's your goal. So revise with them, team up together, and then study together. I would say that the UCAT itself, you might look at that and be like, why, how is this related to medicine? And I felt the same way. The content is unlikely to reappear, but there will be a similar style of studying, right? I mentioned before PassMed and QuestMed, no matter what university you go to, when you get to your clinical years, your final years of medical school, you'll be using the same question banks as everybody else. And these question banks each have over 10,000 questions in them. Knowing how to use lots and lots of questions like this and how to maximize its benefit will greatly benefit you both in the UCAT and medicine. So again, study smart. Don't just do questions for the sake of doing it. Don't just spend hours on it. In terms of how long to study, this really depends. In my year, like I said, I had both the UCAT and the BMAT. And the universities I really wanted to go to were the BMAT universities. So I personally only spent 3 weeks studying for the UCAT. But I would, and I still did relatively well in there. So I got into all of the UCAT universities I applied for. But what I would say is maybe spend a bit more time now that everybody is doing the UCAT. It's going to be a bit more competitive. So maybe a couple months or 3 months. But I say what the important thing to do is consistency and the quality of your studying. You don't want to just do an hour a day for a year because that's not going to help you. You'd rather do 3 to 4 hours a day for 2 months. That will be more effective for you than just sort of doing 20 minutes a day. Um, yeah, but again, it's a very personal preference for how you study. Okay, so once you've done your UK, once you've done your personal statement, you've got interviews. There are general sort of tips I have, and then medicine specific tips. For general tips, I would say obviously dress smart, smile. I can't give you a huge amount about imperial interviews because I'm involved in sort of like the interview process. But what I can say is that you should prepare and practice. Practice questions. Don't lie. It's very obvious when you are lying. And one tip that I found really, really helpful was recording yourself. You will realize that you might say and ah like I do. I still say that. And you might not look at the camera, you might do all sorts, you might twiddle your fingers. You can observe this only if you record yourself. If you're just sort of speaking to a mirror, you might not pick up on these things. Then when you go to medicine specific tips, there are some questions that will pretty much always come up everywhere. Why that university? Why that course? There's no point just saying that I really like the balance between science and helping people because every university and every medical degree gives you that opportunity. There's no point saying that I really like the research opportunities and I really like the hospital placement because, again, every university offers that. Look into why that specific university, look into why that type of course. And then almost every medical interview will have the question, why do you want to do medicine? You don't want to have a very scripted answer, but you should know what you want to say, given that it's a high likelihood it's going to be asked. And you know how we talked about the personal statement about making yourself look like a good candidate? This is likely to come up in the interview as well. They could be like, show me a time you demonstrated good leadership skills, communication skills. What I would say is that interviews for medical school are harder than interviews for other degrees. Just because it's essentially a job interview. Because if you do well in your medical school, if you just pass your exams in medical school, you're getting a job at the end of it. So they put a little bit more emphasis on interviews. Yeah, there's the type of interview will depend on the university. Lots of them are MMI, which is multiple mini interviews. They have stations there, perhaps like 8 to 10. You'll have stations on sort of like why that university, why medicine, but you'll have more practical stations like an ethics station, maybe even a data analysis station, etc. There's lots of ways to practice MMIs. There are paid courses. I volunteer at one at Imperial called PopMed or Potential Medics, but there are loads of them for lots of different universities. And I would say definitely do lots of practice. Try and get a hold of a medical student to do interview practice with. For Oxford and Cambridge, it's a slightly different system. It's both, you have, so I think, 2 interviews, um, unless it's changed recently, which I won't be aware of. You have a very sort of like science based and your own personal interview, and then you have a little bit more lateral thinking, where they sort of put you in difficult scenarios and they ask you to navigate them. Again, finding an Oxford or a Cambridge student, if that is your priority or that is your interest to practice with, is important. Okay. Um, I know this is sort of like a whistle stop tour. If you do have questions, you can always put them in the chat or ask me at the end of the session. There's a lot of information, and I feel like I could talk about get applications for a whole day if I had to. So it's a lot about going out there yourself and researching and finding information. Like I said, I didn't know anybody that was working in medicine, or I only knew one person at medical school, so or two people at medical school. So I had to go and find out information myself. And what I will say is all of the information is out there. You just need to go and find it. Okay, I think alternative routes in medicine is an important topic to cover because not everybody will get into medicine first time. And it doesn't mean you're a failure if you don't get in first time, because you saw before how long the career path is. Many people will fail some years of medical school. They might not get into cardiothoracic surgery, which is 40 to 1 application ratio first time. 1 year in the grand scheme of things means very, very little. Especially in my year was I was the second year of COVID essentially. So the first year was the A levels were decided by an algorithm. There's a lot of people in my year that that algorithm didn't wasn't very fair towards. So being a gap year student is not a bad thing whatsoever. If you're confident in your ability to reset your A levels before October, obviously you'll get your results sometime around August. So it's quite a tight turnaround before you have to reapply. Um, if you're confident in your resets, then reapply. Spend your gap year learning a lot about medicine. Get involved in opportunities, and you can take a break, of course, because you'll have a busy university career ahead. What I will say is, like I said, there's more to medical school than just doing your exams. That whole application thing for specialty training, which I referred to, is very, very rigorous. If you're interested, let me know in the chat, and then I can sort of like pull up an application criteria to sort of show you what other things you need to be involved in medical school to succeed. Um, yeah, let me know in the chat, otherwise I won't cover that. But there's a lot of things that you need to be doing rather than just going to medical school, and you can start that in your gap year. You can also do a postgraduate degree in medicine. You will end with the exact same qualifications. If you don't want a year outside of university, and through clearing or through your fifth choice, if you're able to get ideally a medical related degree like biological sciences or biomedicine, that's a 3-year degree, and postgraduate degrees are only 4 years long. So it's only one extra year total. And the other thing to note is that in specialty application, other degrees count for points. So I won't be able to get points for postgraduate degrees, for other graduate degrees. But if you do a postgraduate, there is a benefit. It's not to say that this is the ideal route, but this is an option if you want to. And then some people consider medicine abroad as well. I mean, it wasn't really my interest. That's just because I didn't really want to leave the UK for medical training. But lots of people I know go to Bulgaria or Cyprus or other destinations to study medicine. Typically, it's if you haven't got the grade requirements, but you've done everything else for the application, you might be able to get into these locations. If the previous two choices are unattractive, then medicine abroad could be a way forward. It's a great opportunity to explore a different culture. That you might not end up working in. But bear in mind that if you do want to practice in the UK, the MLA exam I referred to that every medical student in their final year needs to do, you will need to sit that exam. So regardless of the quality of your medical school abroad, you will need to do this exam. And you'll be treated as an international candidate, which basically just means there's less spaces. As in, so like priority is given to the home students. But again, it's not a bad choice whatsoever. And I know a lot of people that are very successful that have done this too. Okay. I think this is an important slide to talk about because it will be on the forefront of everyone's mind with sort of the issues around junior doctor strikes and people leaving medicine. What I will say is that when you go to medical school, you're not signing a contract to be a lifetime NHS doctor. There are other options. I think this is really obvious in other degrees. Like, for example, I have friends in chemistry that don't want to do anything with chemistry. They want to go into finance or they want to go into business. But for some reason, there seems to be this notion that if you do medicine, that you have to be a doctor. There are other options, and people do other options if they find that being in the NHS isn't for them for whatever reason that is. A lot of people consider doing medicine abroad. I will give you like a little bit of an introduction here because I think it's more relevant for medical students than secondary school students. But this is just to give you an idea that there are other careers also available after 6 years of medicine. So going and practicing in the US, why do people want to do it? Well, it pays a lot more. It pays possibly up to 6 to 10 times more. It's highly, highly competitive, however. You will need to do exams called the USMLE. There's three of them, step one, step two, and step three. They are very difficult exams. And you will need to do electives, which are essentially placements in the US before applying. So you'll need to have connections as well. But I know a lot of people going for this, and it's a move that a lot of people are doing. Australia is a little bit easier to enter general medicine and general surgery. As soon as you do F1, F2, you can go to Australia for a few years or even train there. Um, Again, I mean, I don't know specifically about payment. I do know it's slightly better. I know the hours are slightly better. And also people just like the idea of living in Australia compared to the UK. And then Dubai and sort of like a lot of areas in the Middle East, they really like UK trained doctors and particularly consultants. So if you do become a consultant in the NHS, you can go there. The reason that I highlight this is because you do have autonomy. If you are, say, like a cardiothoracic surgeon, heart surgeon, in the UK, as a consultant, you're looking to make from your NHS salary about 100 to 120,000, which is a very good salary, and that's just your NHS salary. You have opportunities to make money elsewhere. But if you are in the top hospital in the US, you'll probably be making closer to 1 million a year. So that difference in salary is what drives people maybe to consider alternatives. I'll speak a little bit less about these ones, but what I will say is that people are moving into consulting and finance. You'll have a very strong sector knowledge, and these people, they have target degrees and target universities, but they really look for skills. And this is something that an admissions person at a top consulting firm told me, that a person who studies a non-target degree but has all the skills is more attractive to hire because they can teach themselves. A medical degree stands out in non-medical careers. You're not at a disadvantage if you do medicine and you want to change careers. If you've joined medical school, you realize that isn't for you. There are other ways that you can do it. And a lot of people go into medical technology, they have their own business, they have their own startup. The NHS in itself encourages people through their programs to build startups or build medical technology. It's a lot more self-driven, it's less career stability, which I think is one of the biggest advantages in medicine. Um, yeah, but if you are considering any of these things, it's about connecting with people. You can connect with people through LinkedIn, through the internet, wherever. Um, but yeah, and asking them how they find their day. It's not necessarily maybe what everyone wants to hear when they're thinking about applying to medicine, but I think it's important to know that there are other options if you don't want to. Okay, so in conclusion, I sort of wrote a little thing here, but you will feel responsibility right from the first placement. You have power to make people in need feel better. There are negatives, of course, but those truly passionate will succeed. If you have other goals in mind, if you're purely profit driven or you're purely, work-life balance driven, then medicine will continually make you struggle. And it's not the best environment to be if you have other goals in mind. But if you're truly passionate, it's probably the best career that there is out there. If I could go back, I would choose medicine 100%, because of the people I met, because of the environments I'm in, because of the responsibility I get. So that concludes the presentation. I don't mind stopping the recording now, but I can answer any questions.